Well, it's 6:32, so I think we will begin. We've got a great group joining us this evening, and I want to welcome you all very much. I know this is a very, very busy time of year for everyone, so to have you with us means quite a great deal to us, and we hope that you come away with some great information. We are going to now turn this over to my colleague, Michelle Drake, who's going to explain to our Spanish-speaking participants how they can switch to simultaneous translation.
Thank you. Hola y bienvenido a la actualización de las escuelas de salud pública para padres y tutores. Este webinar se transmite simultáneamente en español. Haga clic en el botón de interpretación del idioma que aparece en su pantalla. Si desea escuchar esto en español, muchísimas gracias a Marta Bitton, que es nuestra intérprete esta tarde. Gracias. Thank you.
And thank you, Michelle. And we have a lot of information to share with you tonight. As I mentioned, we're very excited about the start of a new school year. And we know that our students and our staff are most especially excited to be back in-person learning on their campuses. And the good news is, as we start this year, is that we really know how to do this. What we need to keep in mind is that 100% of our schools last year, by the end of last school year, were offering some sort of in-person learning for our students, many full-time. And so this is something that we know how to do. We've worked well together as a community, and we're looking forward to a great and successful year. The slides that we're going to share with you tonight have a lot of information, and we think we'll answer a lot of the questions that we've been getting over the last several days related to our health guidelines and our school plans for opening. We know that the excitement of a new school year also brings with it questions and maybe some concerns about whether and how we are keeping our schools, our students, and our staff as safe as possible. I think after tonight's meeting, you will know that we are doing our very best to do that, and you'll be allowed to have information and questions that will further explore the many things that are going on to keep our schools safe. The one thing that we do know is that we have great partners. They've been guiding us every step of the way as we've opened our schools and our community, and that's Dr. Matt Willis and Dr. Lisa Santora. Dr. Lisa Santora is the Deputy Public Health Officer. She's been the health deputy since 2015. She's the former Chief Medical Officer at Beach City's Health District for 7 years, has a medical degree from New Jersey Medical School and a master's in public health from the State University of New York at Buffalo. But the most important thing about Lisa is that she has guided this process in a tireless way on behalf of all of our students and schools. And we could not have done anything that we've done so far during this pandemic without her assistance. And I think partly it's also because she brings the hat of a parent to the work as well, not just a doctor of public health, but a parent in our school community. And it has shown every step of the way as she helped us through this process. So now we are going to turn it over to Lisa, Dr. Santora, who is going to share with us some guidelines and updates that I think you're going to find quite interesting. So Lisa, I'll turn it over to you.
Thank you, Ken, and thank you for that nice introduction. I am definitely led by my mama bear spirit, which was striving to reopen schools for in-person instruction since the beginning, because we know students learn best when they're in their school community and getting to see their teachers and their friends, and have seen how my children have rebounded by being back once they were able to go back to schools for their school for in-person instruction, and returning to a more normalized school campus this year. It's already rewarding to us as a family. We now have the new challenges of something we probably are all out of practices of the carpooling and chauffeuring as parents and trying to get to soccer practice and back to school night. So as much as I am complaining this week in my head for all the driving, the miles that I'm accumulating, and it's so much different than it was last August and September, when many of us were just adapting to Zoom. And so as hard as it is, it's often easy to forget how much harder it was for us. So there is light. We are getting there. But we are still in this fourth wave. You can see from this picture, we experienced a surge, which we were expecting after the 4th of July. I thought the surge would probably be at levels of half of what we are seeing. And the reason for that, why we even surge in such a highly vaccinated community, is because of the Delta variant. The good news on this slide is that we do see that we're plateauing. There were moments when I was getting daily case reports in the 70s to 80s, and consistently over this week, it's now daily cases in the 40s, which is reassuring that of the plateau that you see on this chart. You can jump ahead. So this is the story of vaccination. Vaccination is our key to the success. As hard as we're having it in Marin County, counties and states across the nation are experiencing much higher surges because of lower vaccination rates in under-vaccinated communities. And you can see here that our case rate among the vaccinated has been dropping down. It's now 8.7, and the unvaccinated case rate is 35. So you're about five times more likely to be infected with COVID during this surge because of the Delta variant. The Delta variant has targeted the spike antigen, which was the original target of that vaccine. So that's why we're seeing increases in breakthrough cases, in breakthroughs. So that's cases among vaccinated persons, but we are still seeing the high protective effect of the vaccine. You can see that in the difference between our vaccinated case rate and our unvaccinated case rate. You can jump ahead. And the big difference is Delta. Delta is a different beast. It is more contagious. It's been demonstrated in some studies to have 1,000 times higher viral load. That's why we saw these large outbreaks among vaccinated populations. The Provincetown is something you've seen in the news that affected us. And we also had our own local experience with a Delta-driven outbreak. So Delta, we were fortunate. We knew it was here earlier because of our surveillance system. We had an amazing team that was tracking and getting people that were new cases to get sequenced. So we knew Delta was in our community. But you can see that by July, Delta just dominated, and its contagiousness is what changed the landscape for us, and also which shifted our approach. Honestly, when we ended the school year, even though Delta was around and was starting to dominate, we were still anticipating that we would be able to move forward with a much more normalized school year. But what we saw was, even in a very vaccinated community, us being impacted by this particular variant and its aggressive nature among both vaccinated and unvaccinated persons. So you can jump ahead. So this is just a summary of what we're seeing between vaccinated and unvaccinated, and it's really important to us. Remember, when we're developing our policy, we are focused on saving lives, so preventing deaths. Number two, we're focused on preventing illness, so making sure people are not experiencing severe disease and hospitalizations. And three is also protecting our healthcare system, so making sure that our hospitals have surge capacity. So we've seen, as I mentioned earlier, that if you are unvaccinated, you're 5 times more likely to be infected with COVID-19. You're 50 times more likely to be hospitalized. 186 out of 187 deaths have been in unvaccinated residents. And just again, we are seeing more breakthrough cases again occur with the Delta surge, which is why it's really critically important, especially as families are re-entering the school year, to be more conservative and engage in lower risk activities. My family had the heartbreaking news this week that we're not going to Hamilton. We have 2 unvaccinated kids, and the decision between going into a crowded theater with unvaccinated kids for a prolonged period of time versus the potential of having to exclude them from school for 10 days if they were to get sick. It's a hard decision, but those are the decisions we need to make as parents and guardians, is how do we minimize the risk and engage in lower risk activities, especially when we have unvaccinated students in our lives, in order to keep our kids in school. So you can jump to the next slide. And I just wanted to end with this before jumping into just the school-based part of our presentation. Again, our goal is also protecting our healthcare system, and what you're seeing, and it's higher and lagging longer than we had anticipated. Even though we've plateaued in our cases, we now have 20 individuals hospitalized for COVID-19. All of the individuals currently hospitalized are unvaccinated. they also are younger. So most of the individuals hospitalized are under the age of 50. And so it's a sad day every day when we see the names and the people and the families who are affected by these preventable hospitalizations. And again, a lot of our policy is driven by thinking holistically about our community and how we protect not only lives, but the healthcare system so people can have care for things beyond COVID. We received our first notice that one of our local hospitals has exceeded 80% ICU capacity. And so we have now engaged our hospital partners in both planning for surge. We had canceled those meetings, and so we restarted those meetings this week, and also preparing for boosters, which again, hopefully will further protect our population, especially older adults who are vulnerable to breakthrough infections, especially after 100 days after they've been vaccinated. So you can jump ahead. So I think it's also critically important to see that this is a different disease in kids. We have seen children be infected. They are not, fortunately, getting hospitalized at the same rates. We're not seeing what you're seeing described throughout the rest of the nation, where, especially in the South, where there's higher levels of childhood obesity and chronic diseases among children, especially asthma and diabetes. You're hearing about children being hospitalized. We are not seeing that in Marin County. We're really fortunate to overall have a very healthy community, and which is why we know it is a safer place for kids to be in school. I know many parents are concerned about sending, especially their unvaccinated children, back to school and exposing their children to COVID-19. We are not seeing that this is causes severe illness in children, which is again why we have to weigh the balance. Is there a zero risk of school-based transmission? No, there is a risk, especially in our elementary schools where almost all students would be unvaccinated, except some of those 7th and 8th graders if it's a K-8 school. But we know that the benefits of children being back for in-person instruction is so much greater than the risk of COVID-19 illness. So we can't create zero risk environments. We can create a very layered, create many layers of protection, which starts at home, like I said, engaging in lower risk activities in order to prevent children from getting exposed to COVID-19. But again, on the balance, we think it's more important for students to be in school. And we also see that school has been a stabilizing effect. We saw last year that the community rates of COVID-19 transmission decreased after school started, and that's because people's schedules started getting more regular and they weren't engaging in private gatherings and parties and travel like they did across the summer. And that's what we're managing now, is just kind of the legacy of some of the summer behaviors, which are often higher risk as students are coming back to school, and we're identifying cases among staff and students and then managing those exposure events. So you can jump ahead. So as I mentioned, we think very holistically, and keeping students out of school causes harm, and getting kids back in school is good for their health. We look at the disease that we're managing, and we're starting to see it shift from a pandemic to an endemic state, and we'll be shifting our approach as we develop more consensus expert opinion. How do we manage an endemic? We still have very rigorous isolation and quarantine required for students and staff who are identified as cases or exposed as cases, and that's going to be shifting. So we need to always prepare for change. But again, we're thinking holistically. How do we optimize children and adolescents' social and emotional development? And school is such a critical part of that, and not just try and have a 0% risk of COVID transmission. And as I said previously, we really have seen that schools provide supervised, structure, stable environments where COVID transmission and risk of COVID is actually less than at home or when you're in the community at large. So you can jump ahead. So we've done this. We've done it when it was much, much harder. We had schools open when we were considered in that purple zone. If you looked at that last chart, we are starting to enter into what would be considered the red tier of last year, but we ended in the yellow tier. And I just want you to see, we did have students in schools when we had none of the protections we had now. We had no vaccinations when schools started. And vaccinations really, as you saw earlier, really are a difference maker in how we are managing this pandemic. And we're really fortunate to have that. But on the counter, we have Delta, and Delta is a game changer, which is why we're approaching the school reopenings with a more conservative approach because of how contagious it is. You saw that we were over 2 million student days by May 14th and only had 12 suspected in-school transmission. And then one outbreak with the Delta variant caused that number to increase by 7. And so that's why we are taking this more conservative approach as we open schools and want to give the opportunity for our schools and staff to shore up their policies and procedures and protocol so we can really navigate the next couple of months with Delta in our world before we have access to pediatric vaccinations. So you can jump ahead. Oh, and the colors just indicate, if you remember, I forget, the old world was when we had the blueprint for a safer economy. So we were in the purple tier and then the red tier and the orange tier. And we changed our decision trees and we finally got to the yellow tier. We never got to green. Well, we did officially, if you looked at the data, we did get to green right before the 4th of July when people started partying again. And so that's what the colors reference is the tier that we're in when we reopened schools. So we reopened schools were open in January and many schools reopened in January when we had much higher levels of community transmission than we even do now. And so we evolve. This virus changes and the survival of the fittest, it's not by your muscular strength, it's your quickness of adaptation, and our public health guidelines have been adaptive, and that's been intentional. We know that viruses change, they mutate, that is a known, that's how they survive for thousands of years on our planet, and we knew our guidance needed to change. We led our state with the development of this guidance. We didn't have a guidance document from the state when we started the reopening of schools, and the state has caught up to us, and we have more resources now at the state level. And we've been learning how the virus behaves and adapt our guidance to reflect what we have learned and how the science has evolved. And so you're seeing now the 4th version of the guidelines as we again try to adapt our guidance to what we're seeing, what we've learned from the past year and what we have learned over the summer with Delta circulating in our community. You can jump ahead. So I think this is just to highlight that it's going to continue to evolve. We're all hoping to get back to that truly normal state. We're hoping that we don't see such a high 5th wave and that we have sufficient vaccination rates, especially after pediatric vaccines enter into our market and we have boosters, vaccines, and more rapidly evolving technology and vaccinations to keep this particular virus at bay. The challenge is, though, is that we are a global society. And so while we may cocoon ourselves with vaccinations, just to remember that the Delta variant entered from a country with much lower vaccination rates. And we will continue to be challenged as long as this virus can run rampant and mutate in different ways that will always strive to outpace medical technology. So again, why it's so critically important for us to think holistically about how do we reduce risk in our lives by engaging in safer activities? How do we stay healthy? How do we eat healthy and stay physically active as a family and promote health and well-being as we navigate this last, hopefully the last leg of this pandemic, but also preparing it for it to be endemic. That means when they described 1918, the influenza pandemic, it was just that, and now we're used to having flu in our lives, and that's what we need to be prepared for as we navigate this next year or so. Is that we're not going to get rid of this COVID-19 because of it is circulating throughout countries that don't have the same access to the resources that we have in the United States. And and vaccination is key, and we're going to be looking as we achieve higher vaccination rates. How can we relax many of the guidance that we have in place so we can again try and normalize the learning environment and the social environment, maybe more importantly for students. Jump ahead. So do you want to jump in? I saw Mary Jane snuck in. Do you want to speak to this? This is her elegant design, and we think it's a great approach to navigate the next phase of our reopening. Mary Jane, do you want to jump in here?
Lisa, I'm not positive that Mary Jane is on.
Okay. So I'm going to fake it to make it.
I know she's with us, but I can.
You want to do this one?
Yeah, sure. So what you're seeing here are the Marin County Schools Mitigation Strategies Continuum. This would be a guide that would help us as we especially address the issue of mitigation strategies on masking and classroom and mixing of students on an ongoing basis. As we know, and we've heard a lot tonight, this is an evolving situation. So currently we are at C and know that it could be a period where we either way on this continuum. We know which direction we want to move in, but this will help guide and activate certain discussions about new potential changes and guidelines that we would want to make based on the data that drives this. Lisa, did you add anything to that?
Oh, look at her, there she is. Anything you want to add, Mary Jane, to this?
No, Ken was perfect. Thank you.
So we originally went, like I said, when we ended the school year last year, we were hoping to have a 10-point document, to go from a 30-point document to a 10-point document. And then we recognized that as we navigate Delta, let's not recreate the wheel. We know what worked to open schools in Marin County and what kept schools open in Marin County last year. And let's decide which levers need to stay on and which levers can go off. So what can we relax and what needs to stay restricted in order to keep schools open? And I'm just gonna preface that we've already learned a lot in this week, and there's already areas of concern that we've identified that are creating exposure events. And we anticipate on updating our guidance probably as early as next week to address some of the higher risk areas where we're seeing the potential for having to close classrooms, which is not what we want to do. Our goal is to use modified quarantine and having universal masking indoors and outdoors. So mask on mask exposures allows us to engage in modified quarantine, which keeps kids in school. So at this point, that's where we are. We're recommending, Marin County Public Health recommends that all schools have outdoor masking policies, and it's required for all schools, whether private or public, you are required to have an indoor masking policy. And that means all students and staff indoors, whether you're in a private, independent, parochial, or public school, are mandated by the state and ordered by the state to require masks be worn indoors.
Lisa, before we move off the slide, there've been a few questions about what would make the jump from one grade here to the other.
We're going to be looking at our data, so our community level transmission, and we're going to be looking at the behavior of Delta in our schools. So we are definitely going to be in C when we update our guidance, because we're actually going to put some more restrictive recommendations in. But once we see that the community level transmissions drop to low, that's when we're hoping to relax a lot of our restrictions, because that would mean that there's not a lot of COVID-19 circulating. We have very busy school nurses. So this is just a shout out to school nurses and to our school teams at public health. We have very busy nurses this past 2 weeks because we are identifying COVID positive cases on the school campus. And it's not because they were infected on the school campus. They typically are infected outside of the school, but then they are identified as being a positive case and identified as having exposure events. And our goal again is to minimize these possible exposure events and keep as many kids, as I said, I never will get it in my own house, but a perfect attendance rate for all kids in school. So that's our goal. So we'll be at C, we'll be looking at the school environment, the school context, the local context. And our goal is we're all overachievers and want to get to A as quickly as possible, but that really depends on the community working together. You can jump ahead. So face masks, that was a large conversation last week. Face masks work. They're simple, safe, and effective. They reduce individual risk more than 70%. It provides source control. So if you're infected with COVID-19, you are not spitting out COVID-19 into the world, and it also protects you from others. Not as much, it's up to 70% source control, keeping droplets in. And then if you're wearing a mask, if you're exposed to someone coughing or sneezing or spitting while they talk, it provides around 20% effective. And that's why, again, just to reiterate, we are urging all Marin schools to adopt universal mask wearing policies indoors and outdoors, while we have moderate to high transmission. If you go to the CDC website, we are at high levels of transmission. Our local data shows us that we've shifted down as we've plateaued into a moderate level of transmission. So that's indicating we're moving in the right direction. It is required by all schools to wear mask indoors, schools and staff to wear mask indoors unless there's an exemption that you can see in the California Department of Public Health. It is, we are strongly urging all schools to adopt outdoor mask policies to have universal masking outdoors. So we can jump to the next slide. There's been a lot of requests from the public around references and research supporting mask wearing. We regularly do a review of research. The challenges, we're in a pandemic, and developing policy when we're in a pandemic can be challenged because there isn't a lot of research. We have, even in the United States, as resourced as we are, you have local health jurisdictions with limited resources to engage in original research. That being said, we will be publishing our first version. Every month we issue a bibliography to the school community, so you can see the data that we're drawing on and the trusted resources that we go to. And consistently, we're not seeing evidence that it causes harm, and that the benefits of face mask wearing is outweighing the risk of face mask wearing, especially with the introduction of modified quarantine, where when there's an exposure event and both student and staff, or staff and staff are wearing masks, then we can keep students in school. So we'll continue to review this. I'll just highlight the impact of the last one from the bottom, the impact of face masks on children, a mini review. They only found one pediatric study. And again, this goes back to, there's just a dearth of research when you're in the middle of a pandemic and your entire public health system is focused on response. And there should be more research on this. But at this point, the benefits outweigh the harms of, we believe the benefits outweigh the harms of having outdoor mask in play. And that's where we stand right now. We are always ready to adapt and change our recommendations. What you're seeing around the Bay Area, though, is other health officers adopt the same approach of strongly recommending outdoor mask wearing during this time as we navigate Delta. So this will be published and you'll have access to all of those references. So I think I've said this enough, so we can jump to the next slide. And this is our 32-point guidance. So you can go onto our website. We're going to run through this pretty quickly because I want to be able to field as many questions as possible. The first 5 are really, again, just our basics, that everyone should have health and safety protocols in place. Training is so important. I can't tell you already how, when schools restart, it's almost going from a dormant state. And this is not in any way to disparage. I know there's many school staff that are working over the summer and to keep schools going, but it's almost like schools are in a dormant state and then they open up. And there's so much activity, new students, new staff, all trying to get onboarded. And so training is really the key. And again, the reason for taking a more conservative approach while we're reopening is to provide schools the opportunity to shore up their policies and protocols. So for example, when one of our class assignments, seating as charts has been one of our recommendations since the beginning, because when we have a case and an exposure event, so someone's identified as positive, our first step is to identify who are their close contacts, and knowing who they sit next to is the first step. And during that first week of school, we saw all the classrooms didn't even have their seating charts in play. And that is in no way to criticize schools. It's just that it takes time to get the systems running. So which is another reason why we took a more conservative approach. The next thing to point out with these first 5 is just the critical importance of our public health liaisons. And I always like to use this as an opportunity to thank that school staff. You have amazing school staff who attend weekly meetings with us, stay up to date on everything related to COVID and making sure that all of their COVID safety plans are updated and they know how to manage when there is an exposure event. And we have had a lot of exposure events already. So we have a new crew of we have both seasoned veterans and a rookie crew of public health liaisons, but they work tirelessly to keep up to public health. They all have earned a master in public health in my book and are key to our success. So you can jump to the next 5. The next 5 is really, I just want to emphasize the critical importance of symptom screening. A lot of the preventable exposure events happen when someone is at home sick, they're getting tested for COVID, and they send kids that might have just a little bit of a symptom, but not too sick, or the staff goes to school when they're symptomatic. So the first step, besides not engaging in high risk behavior at home to keep our schools community as healthy as possible, is monitoring for symptoms and not sending anyone to school if they're symptomatic. anyone who develops symptoms, and we are more conservative in our approach at this with the start of Delta. We used to say that with runny noses and fatigue and some non-specific symptoms, they don't need an evaluation or COVID test. When we started this new school year, we are recommending testing for every symptom until we can learn how COVID behaves, especially this Delta variant behaves in that pediatric population. But if anyone's symptomatic, they should not be going to school at all. If they develop symptoms at school, they'll be sent home. And this is, again, a way we can, again, protect that school environment. We're working on a whole boatload of testing strategies, really thankful for some early partnership with San Rafael City School Districts who launched response testing with us, being ready and rapidly deploying a crew of folks to provide antigen testing. We're going to be piloting a home-based antigen testing where families will have access to the Binax test or an antigen test at home and be able to test their kids if they develop any symptoms in order to initiate that process of evaluating for COVID or not. And again, testing is a key strategy. We met with another vendor today, and we'll be exploring other ways to enhance testing availability in our entire community and also in the school environment. So, and we just expect all schools to work with us on testing. So it might be, for example, just being ready to test a classroom. If there was an exposure, we're having lunchtime exposure events where someone tests positive, they spend time eating with a group of kids. And so when you're eating, that's one of your highest risk activities. And so that's when we engage in response testing. And we'll be, the good news is we didn't have this resource at the beginning of last year either. So we didn't have the same testing resources. If you remember last year, we had at some points up to 2-week turnaround times in testing. And now we have more access to testing, although supplies are limited. We just learned from the state that they don't have any more Binax antigen test kits. So we're going to adapt to that as well. But we do see testing as a key strategy moving forward. We'll be updating all of our templates for each scenario on exposure. And we have a decision tree, and our family handbook has been published, and we'll have a screenshot of that so you can link on to those resources. Again, but if anyone tests positive, you should be isolating at home, and then close contacts should be quarantined. And then we'll be working again with modified quarantine, trying to keep kids who only had a school-based exposure, mask on mask, school-based exposure, trying to keep those kids in school even if they're unvaccinated. So this next group, should we pause, Ken? You're probably seeing more of the chat before we jump into the not applicable.
I think we can keep going, and then we'll have questions based on what's come in.
All right, so this is the next group of not applicable. And I'm scanning this. So none of these are going to be modified yet, including what I'm anticipating an update next week. So what universal masking is also allowing is us to have the return of full-time classroom instruction for all students. So that allows us to eliminate the physical distancing requirement. We see how effective masks are. So students don't need to be more than 6 feet away from each other. If you remember from last year, once we added the physical distancing requirement, school classroom sizes had to be cut in half many times. And so what we have seen is if we have masks on students in the classroom, we can eliminate that physical distancing requirement and maximize student attendance in our public and private schools. Right now, we are not considering ending the stable classroom groups. This is when only one kindergarten classroom could ever hang out with another kindergarten classroom. That was to facilitate contact tracing and to minimize potential exposure events. But this does increase risk when kids are interacting with multiple classes. If there is a positive case, it becomes harder for us to identify those true close contacts, but it's not under review. And again, with high schools and middle schools, when we reopened at this point was moot, where we really recognize that middle school and secondary school students have to mix classrooms, and the key for protecting them has been just wearing masks in the classrooms. We were really strict in saying all the desks had to be face forward, and that is not an optimized learning environment. And again, a lot of these schools is really trying to relax restrictions as much as possible to optimize the learning environment, to let teachers do what they have been trained to do so well in creating learning environments that meet different needs of students. And so students are allowed to have desks facing each other right now, as long as they're wearing masks. And staff can participate in multiple classrooms as long as they, again, we were really creating very small groups and not allowing any mixing. And we do see mixing as a critical part of creating a positive learning environment for students and allowing students to have access to different teachers and staff. So what you saw last year is very choreographed entry and exits. We're not requiring that now. We don't see that COVID is a risk of COVID for incidental contact during the entry and exit. Some schools may keep it, and this is important to note that schools can be more restrictive than us. So they may keep some of these procedures they had in place, but we're not recommending it. We were coordinating all mixing. Again, this is a highly choreographed, orchestrated event when kids and families were coming on to the school campus. That is not required anymore. And students now can move throughout the school day without, again, coordinating their scheduling, which classes can leave and walk down one side of the hallway. So we're not requiring the orchestration like we required before. Number 18 is going to be revised. We were saying large gatherings were not prohibited. Based on the behavior that we're seeing, we're going to be revising this and saying large gatherings should be held outdoors and having a capacity limit at 25% if a gathering is going to be held or school assembly is going to be held indoors. So you're getting the preview tonight that 18 is going to be updated. 19 was just referencing having the schools see their entire campus as a potential classroom in order to achieve the 6 feet distancing. It's always better to be outdoors if you can to reduce the risk of COVID-19 transmission, but we know learning teachers really depend on the classroom and all the tools in their classroom. So we're not encouraging them to seek outdoor space for their classrooms, but outdoors is always a good place to be. That being said, what is applicable is we're really seeking to optimize ventilation in that classroom environment. You're at higher risk for COVID transmission when you are indoors. So the next run is around removal of the concern around fomites. So fomite is when you touch an object and you think you're going to be infected by touching the object and then touching yourself. We are not seeing that as a driver infection. It's really airborne and droplets, respiratory droplets that cause COVID-19 transmission. So kids can play on the playground. They can share. 21 is, again, just thinking outside the box for larger space to maximize that 16 space. We are encouraging meals to be outdoors in 22. Again, it's better to be outdoors than indoors. What we're considering right now is if we are going to be recommending eating in stable groups. A lot of the challenge in our exposure events so far to date have been kids mixing classrooms when they're eating, and a positive kid not knowing who is that close contact when someone is positive and who they're eating with. Eating is one of our higher risk activities, so that might be something that is revised earlier. But people can eat indoors and outdoors. Really might be more about us knowing who you're eating with. So if there is a case, we know who the close contacts are. And 23 is just, we really were, this is not to de-emphasize the importance of hand hygiene. Hand hygiene is what people are not doing enough of, but we're not saying it needs the entire classroom schedule needs to change to build in hand hygiene. So just encouraging regular hygiene practices. 24, we've already spoken about. That's the requirement for indoor mask wearing and the strong recommendation that all schools adopt an outdoor mask wearing policy. 25, just the importance of training. I know this is one of the concerns among many parents who are concerned about face coverings. It's really important to teach people how to use their face covering appropriately, especially younger kids, and to observe it and to model good face covering behavior. Even I see adults are some of the worst culprits of poor face covering behavior. So we see this importance of that. The next run is just around, again, fomites, 26 and 27. It's okay to share equipment. People just need to wash hands. 28 is there were some schools that had physical barriers. There's never science to demonstrate that they are effective. And sometimes we're concerned they actually would have people relax their hygiene behaviors. So number 29 is, so that's the fomite world. Number 29 is still limiting essential visitors, especially when Delta is circulating. Our workers should adhere to all of our health and safety guidelines, and substitutes, contractors, visitors, and volunteers should be fully vaccinated. Again, you want to mitigate the risk as much as possible. As I said earlier, unvaccinated people are 5 times more likely to be infected with the Delta variant. So we're recommending that schools limit visitors, volunteers, and contractors to those who are fully vaccinated. We want everyone to get vaccinated as soon as possible. The state order, the state order caught up to us and now requires staff that are to have the vaccine verification vaccine verification, and those staff who are not vaccinated must undergo weekly testing. We are also requiring that we get student vaccination data. The first question we ask when there's a close contact is if there was an exposure event, who are the close contacts? And then we identify the close contacts by their vaccination status, because that informs our quarantine recommendation. And then we identify if they were masked or not if it's an unvaccinated group, because again, that informs our quarantine recommendation. We also see vaccination status as a tool that will help us relax some of the restrictions that are in place. And so we'll be looking at schools with high levels of vaccination rates and trying to have that as a tool for relaxing some of the guidance and again, trying to normalize school operations. Number 31, ironically, is still not updated by the state. We've been waiting, I guess it's not ironic, that's a bad use of that adverb. But it's still not updated. It was supposed to be updated weeks after this was first drafted in June. Right now we're preparing for ABAHO, it's the Association of Bay Area Health Officers. We'll be releasing ABAHO guidance this Friday on youth activities, and it really is promoting the importance of staying outdoors and the role of testing in students who are engaged in higher risk activities if they're unvaccinated. And number 32 is unchanged. We just had to adapt ourselves. We created the term school site specific protection plans. Then the state changed it to a COVID-19 safety plan. So we're adapting to ourselves and calling it a CSP. And so our expectation is that all schools and districts will review our updated guidance. They'll update their CSPs to reflect the changes in our recommendations or changes in state orders, and that they'll post this guidance so families and parents and guardians can review the guidance and make sure that they understand what's expected, again, in order to create the safest possible school environment. Woo! Did it. So testing, Delta is circulating. If you have any symptoms, we recommend you getting testing. We just have reviewed, we have 100 open testing slots every day. We work with Curative as one of our primary providers of testing, and we have found there's a glitch where they're not posting at all of the appointments that are available. So we'll be working with them to make sure they post all of the available appointments so you don't see that testing isn't available. But we have testing resources. Like I said, we're working with another vendor to bring in potentially even more testing resources into our community. And just encourage anyone, again, if you're symptomatic, assume it's COVID-19 and get tested. My family is one of the most highly tested families. Maybe I'm slightly paranoid, but you just don't know. It's that contagious. And if you shouldn't assume at this point that it's just your typical allergies for the season. That's been one of the most common stories that we've heard, is that someone thought it was just a scratchy throat from allergies. This is the season they usually get their allergies. And when their allergy symptoms don't improve with their medication, they get tested. And so that's a delay in diagnosis, and it creates exposure events. So stay at home, get tested, prove it wrong before you come back into that school environment. And then jumping ahead, vaccines, everyone should be vaccinated at this point. We're really proud of the vaccination rates of our 12 to 17-year-olds. I'm really thankful for our partnership with the schools and the Office of Education to have vaccination available. We continue to see people vaccinating at higher rates. It really doesn't make a difference, especially in that secondary school environment where you can be vaccinated and your quarantine. The difference between vaccinated and unvaccinated is quarantine, and we really have the opportunity to avoid quarantine in this group. We are preparing that for vaccination of the pediatric population 5 to 11 in late October, right before Halloween. That's based on reading tea leaves and also knowing the schedule of the Advisory Committee on Immunization Practices that meets on the 23rd of October. So if we follow the past, we are preparing for that by the 25th. I think that's a Monday, that we'll be ready to start vaccinating the pediatric population. If you remember last year, we know some of our behaviors are consistent. Halloween is another indoor gathering period, and that's when we saw our surge from Halloween into Thanksgiving. So that's when I would predict our 5th wave. So I will have my kids first in line. I'll do it the right, I'm not going to cheat in any way, but they're certainly going to be signed up that first week for getting vaccinated, because again, it's going to be a critical strategy for us to avoid that 5th wave. We Again, this vaccinating our pediatric population is voluntary. It's completely voluntary. Parents and families need to consider their risks and benefits for vaccinating. So we're not forcing vaccination on anybody. I know many parents, especially of younger kids, want the opportunities to talk to their healthcare providers around the COVID-19 vaccine, and we strongly encourage that. And we're working with our pediatric partners across the county to make sure that they have access to vaccine. Mass vaccination events like we've had at the Marin Center might not be the best vaccination environment for your child who's 5 to 11. And we strongly encourage families to start talking to their healthcare providers now around the benefits of the COVID-19 vaccine based on the safety data that we've seen for the older population, that 12-year-old population. It's time to start having those conversations, but there is no mandate or requirement for student vaccination. So these are the links we'll be sharing and posting these this slideshow to all the updates we have. We've updated our decision tree, and we're already going to have to update that again because we are going to be having a change in the antigen testing in order again to really try and facilitate the use of home-based antigen testing. So we'll be updating that. It's getting, just for everyone to be aware again, the supply chain for those antigen tests are getting harder to, it's getting harder to get those tests. So don't be surprised if you can't access online ordering of antigen tests and at this point, probably going to purchase it in store is going to be the fastest way to get antigen tests right now. And then we do have a supply that we're going to be piloting with schools, and we'll be prioritizing our supply for our most vulnerable students in our lower healthy place index schools or schools with higher percentage of free and reduced lunch. And I think that's it. So what's next? Do you want to run through this, Ken?
Sure, I'll do this very quickly so we can get to some questions. We have a September 14th public health update for the school communities. These are fairly regular updates we provide for our school leaders and site leaders to review with public health the guidelines and have any questions answered, especially if guidelines are evolving. We also meet weekly with the public health liaisons at each of your children's schools. These are a very dedicated group of people in our community at each of our schools that are interfacing with public health and our Rethinking Schools team on a regular basis. The rest of these things, actually, I'm going to ask our team to put the link to the Rethinking Schools website again in the chat. Please copy that link. You can use it to get to this document that we've been sharing tonight. So all this data is available to you. Also, this has been recorded this evening, so you can re-access it or share it with friends who have not been able to participate this evening. So now I think we will jump to some questions. Let's see, we'll start with this. A lot of talk tonight about testing. It's such an important feature. Why isn't public health recommending surveillance testing for all students in schools?
Well, we've had experience with surveillance testing. Some of our school districts last year participated in surveillance testing, and we found it was low yield, honestly. Screening asymptomatic students, especially the younger they are, who have lower viral loads and are more often to be asymptomatic hasn't proven to be an effective strategy in case finding. Keeping kids home when they're sick and then symptomatic testing has proven to be very, very effective. That being said, we are exploring options now with possibly another vendor to see if that's a resource that can be brought to bear. Again, it takes a lot of effort. When we did Binax testing in a school just for response testing, it's around 2 hours to do 100 kids. And so again, you have to really balance the benefit, think of the benefits. If it was a very high yield where we're finding cases and asymptomatic kids by screening, it absolutely be a recommendation from public health, and there'd be data to support that. And when San Francisco did its first round of testing tens of thousands of students, they only found a couple and less than five cases for an entire unified school district. And again, you just really are trying to balance the time it takes and the yield. Are we going to find cases? But that being said, we're always trying to bring all resources to bear in Marin County. There are schools that can sign up right now, and if they want with the state and get access to testing. Again, the testing supplies are limited, the antigen supplies are limited. But there are schools that may be engaged right now in asymptomatic screening of students. What we've seen though is a lot of the schools that did engage in it last year, because they didn't identify any cases, have suspended those programs that they had in place last year.
There were a little bit of a flurry of questions related to the redoing of number 18 on large gatherings, especially related to events that happen this time of year, like back to school nights or parent information evenings.
Yes, that's why it's not yet presented. We want to make sure it's very clear guidance and on the numbers. So what we're really concerned about, having parents, my husband I didn't go, I did soccer practice, and my husband did the back to school. Having parents in a classroom for a short period of time, if they're all masked, there's a higher risk there. Our concern are those greater than 500 person gatherings where we bring everybody into a school assembly. And so we want to just review that with the schools team before we make our kind of final cutoffs and descriptions of what size number would be where you need to consider having capacity issues. But again, some of it's just trying to be commonsensical right now. That's not even, I think, a real word. But again, if it's indoors, you have a lot of people, especially if it's a mix of unvaccinated and vaccinated people, asymptomatic or symptomatic, you have a higher risk of spread, especially with the Delta variant. And so that's one of the things we're considering. We want to get it right when we revise it and consider what are all those activities in the schools, so we don't unintentionally, there's always unintentional consequences when we revise guidance. So that's why it's not there yet.
We understand that we're waiting for the state for things like sports and those activities that students do outside of school hours. In the meantime, related to sports practices, soccer, outdoor practices like that, are we still recommending the use of masks in that situation?
Yes, we would recommend the use of masks. We know this is the area that people most inconsistently use masks. Outdoors is a lower risk space, but the more when you're engaged in high contact sports like football, that's going to have a higher risk of transmission. So our first recommendation, especially anyone over 12, if they're engaged in more of these higher risk activities, they should get vaccinated first. The Delta variant we know is breaking through. So we do recommend wearing, trying to optimize the time outdoors with masks, but we also understand in those events that there's not going to be 100% consistent adherence to masks because kids, it's harder to do. But we strongly would recommend people continue to wear outdoor masks while engaged in these activities.
And the state.
Hey, Ken, can I jump in here? There's a question coming in about music and the recommendations related to that. Dr. Santora, could you please review where you are with that?
So I believe the final recommendation, it's still under review it's trying to get a lot of doctors to agree on guidance is challenging, but we thought it was really important with this particular guidance to have a unified front with the Association of Bay Area Health Officers. So there's consistency across the Bay Area in our recommendation. At this point, our recommendation as written is that we're recommending music, especially woodwind instruments where there's a higher risk of transmission, and singing be held outdoors when possible. I know that's one of the things that's frequently in my inbox, the critical importance of music, that it's not an extracurricular activity. I absolutely see music as part of the core curriculum in schools. So it's not discriminating in that way. It's just the nature of the exposure risk itself. And I've mentioned this previously, we've had tuberculosis exposure events, a large one with over 500 contacts due to music and singing and woodwind instruments. And so that's why I am anticipating the guidance that's going to be released is going to recommend that music be held outdoors. Again, this is while we have high transmission rates, and we do seek to normalize our recommendations as quickly as possible. But that woodwind instrument in particular and singing project respiratory droplets. So outdoors is always better. Is it a mandate or an order? It won't be a mandate or order. It's a strong recommendation.
Got it. Mike Grant, you've been monitoring questions in chat. Maybe we could have you ask a few in the 5 minutes we have left.
Sure. Thank you, Ken, and thank you, Dr. Santora. So there's a question about the continuum and about the guidelines that are not currently applicable, and what thresholds would we would we move from B to C or C to D? And there's also questions related to that. We're supposed to be in C, but it seems like some schools are just in B. Can you address the difference between B and C and how we move back and forth?
Well, B and C, B is going to be obviously less restrictive than C. This is where there's an art and a science to what we're doing. So seeing the exposure events as they unfold as the new school year starts. And again, so we're going to be in C still, and we're going to provide more restrictive guidance in some areas based on what we've been learning over the past couple of weeks. But we also, again, there's not a hard cutoff. We're going to be looking at the transmission rates in the community. So what's the likelihood that COVID is even coming into the school? So as there's less of a Delta variant circulating in our community, it's less likelihood if someone's symptomatic that it's COVID. So seeking to get back to that low level of transmission, which is where we were right throughout the end of June. When school ended, that's when cases started going back up again because people started gathering and engaging in more social activities. So that's what we're going to be looking at is just the community transmission rates, the behavior of COVID in the school environment, how many exposure events are we managing and monitoring, and what are we learning from those events? So it's going to be both an art and a science. And I appreciate everyone wants a goalpost, and it feels like a moving goalpost, but it's us being adaptive and trying to create the safest possible environment, while also optimizing that environment for the health and well-being of students and staff. That was like a non-answer.
Yeah, no, but
it's the art and science of medicine.
Yeah, well, and so there is a question that's very specific about why not just require masking outdoors? Is that a consideration?
We see this as a partnership. The guidance that we've developed is a partnership between us and the schools. And just like we don't have an order that you wash your hands, you should wash your hands. And it's like a contract. And we hope that our partners, without issuing orders, see the science and the rationale, and we spend the time explaining the science and rationale behind our guidance, and then adopt our recommendations and our strong recommendations. And again, some schools may stay more restrictive, and we respect that as well. So I think that's where we are. We don't want to have to have just a series of 32 orders to match each of these guidance documents. We hope that we've demonstrated that we are data-driven, we are evidence-based in our approach, we're student-centered, and we strive to strike that balance between preventing disease and supporting the learning and emotional development of our most valued assets in our community, which are our students.
Great, and Ken, what I just want to say to Lisa is that the guidance last year was just that as well. It was guidance, and the schools in our community embraced it as if it was an order, and we did really well by that. We followed the guidance of public health, and that's what we're striving to do again this year. And as it proved so successful in terms of getting kids in school and keeping them in school last year. So I just want to add that piece.
And these are, your districts are autonomous. These are autonomous school districts. So again, these are collaborations, and I'm really just thankful. We just describe it as radical collaboration. I think one of the reasons Marin has been so successful, and I know it feels it's too hot and too cold, and never, probably for some of you, feels like it's never just right. But we communicate regularly with your superintendents and your school leaderships, your school nurses. We seek feedback and input. We listen. We strive to answer every email and hold ourselves accountable to these decisions. And that's the challenge of public health. Every time we make a public health policy, it restricts individual freedom, right? There's a rule around wearing your seatbelt now. Why it seems like a no-brainer now. Why are you required to wear a seatbelt? It should be your individual choice. And I think that's just where we're just striving. Again, we're constantly studying, we're working with teams, we're seeking feedback and input, we're listening to you and striving to make the best policy recommendations. And when we think it's really important, that's when we issue an order. And we really want to stay aligned with the state in its orders. The indoor mask mandate was a time when the Bay Area health officers came together again and said, we really think it's critical at this point before a hospital surge to implement a mask mandate again. And we take that really seriously because it does those decisions impose on individual decision making, and it's a hard space. And we seek consensus. We look to expert opinions when that's available. We love to have a randomized controlled study of every decision we make. It's just not there yet. And we seek to have these opportunities to be transparent and to share with you what's driving our recommendations and having a bibliography. And I'm just thankful to all of the collaborators that inform our decision making and tell us, and we're always ready to adjust and adapt and change. We're not, we've seen where we've gone maybe too far and need to come back, or where we've been too relaxed and we need to consider recommending something more restrictive. But it's us working together as a community that's going to get us through this fourth wave, and hopefully again working together as a community to keep that fifth wave at bay when Halloween, we just want to go and start trick-or-treating and have Halloween parties. We know that's coming, and hopefully we'll be in a better place than we were last year.
Thank you,
Thank
Lisa.
you very much, Dr. Santora. On that note, we're at 7:32 actually, and we're going to begin to wrap up. And before we do, I want to say a special thank you to the leaders of the 16th District PTA, to our Marin County home and parent clubs, and to the parent associations in Marin who do so much for our schools and help spread the word about this event. We thank you. We had close to 400 people attending tonight, and it's thanks to your good work in spreading the word. Reminder, this event is recorded and can be accessed at any time at the Rethinking Schools website.
I'm going to say one more thing. I just want to thank all the parent volunteers. I'm a horrible parent volunteer, and I'm so thankful to all of you out there who spend extra hours of your lives just curating an amazing day for our students, and truly am grateful for all the work you're doing behind the scenes to normalize that learning environment in the school campus again. So I'm not there, I'm there with you in spirit, but I'm always so thankful for all you guys do to create those fun experiences. And our goal is just to have as many experiences as we can. We know your events are often social and traveling, and we're just trying to try and optimize those while trying to give guidance on how to keep it as safe as possible. So thanks for all that you do.
Thank
Sorry
you
for
so
interrupting.
much. Thank you, everybody. Have a good evening.